Inside this hospital near Bogota, the fight against COVID has been raging. This patient, lying face down, told us he'd put off getting vaccinated and got sick. In Colombia, the predominant COVID strain is the Mu variant. It was discovered first here in January.
We can conclude that the Mu variant can transmit 1 or 2 times more than the original variant described in Wuhan in China.
Now, Mu has been identified in all 50 states. It's not nearly as contagious as Delta, but several weeks ago, the World Health Organization labeled it a variant of interest. Right now, it makes up less than 1% of COVID cases in the U.S., though experts say it's slightly more common in places like South Florida because of travel to and from Colombia.
We take everything like that seriously, but we don't consider it an immediate threat right now.
Still, preliminary data suggests Mu might be more resistant to COVID vaccines than other strains. How concerning is that?
Well, I think the idea of variants that have certain mutations that make them able to evade the protection that the vaccine currently offers us against Delta is it's a real possibility with variants.
This week, the WHO reclassified 3 other variants, Eta, Iota, and Kappa, to monitoring status, saying they no longer pose a major added risk to global public health. Should we expect to see variant after variant for the foreseeable future?
I do think it's something we need to get used to, especially while there's really unmitigated community transmission in many areas around the world, around the country.
And Gabe, now the CDC believes that Mu is actually on the decline.
Yeah, Lester, it simply hasn't been able to compete with the Delta variant, but experts say no matter what vaccine you get, and if these variants might end up being either slightly more or less resistant to these vaccines, getting the shot is the best way to protect yourself long term against the virus.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.